Can PCOS lead to cancer? Yes, that is the topic of today's discussion. PCOS, also known as PCOD, or what we call it as a polycystic ovarian syndrome. It is one of the most common endocrine health problems which happens to women ranging from 15 to 55 years of age. Now, PCOS, because it is a metabolic problem, the prevalence of this problem is increasing to many folds. At the same time, when we are talking about the cancer, the moment we hear about the cancer, the word itself creates a fear inside. And it's so much possible, isn't it? But when we talk about the cancer, talking about the country like India, where I am located, we are a cancer capital of the world. It's not a pride in talking about it, but it is a fact. And this data has been out in year 2024. So when we are talking about the PCOS, such a common problem, and a cancer capital country like India, correlating both of that is a very important. Why? Because PCOS women, they hear all sorts of myths and facts concerned with the PCOS. Many times they hear something which is completely absurd. Sometimes when the patient comes and consult me, when they ask this kind of a question, doctor, I have PCOS, means I'm going to get cancer. It really kind of creates a fear within myself also. That is that so? And if that is so, it becomes my moral responsibility to create awareness on this topic. And that's what we are going to talk in our today's video. Namaste. My name is Dr. Tanvi Mayur Patel. I'm an endocrinologist, hormone specialist doctor from Mumbai, India. Lot of people I see with the PCOS, and when we talk about the PCOS, which is actually a gynecological condition. So when we're talking about the gynecological condition, this condition has been linked with certain gynecological cancers. Now, when I'm talking about the gynecological cancer, I'm talking about the three cancers most importantly. First is a uterus cancer, second is the ovarian cancer, and the third is a breast cancer. So let's discuss one by one about them in today's video. Okay. So first we are going to talk about the uterine endometrial cancer. Now, what is endometrium? Endometrium is nothing but the innermost lining present within the uterus. It is this endometrium which gets shed every month after month during the menstrual cycle. So what happens? When a woman gets a menstrual cycle, this endometrium, whatever was excess collected, gets out. Okay? But if for any reason this endometrium doesn't get shed, and if it keeps on accumulating, this will increase the thickness of the endometrium. Higher the endometrium thickness, more the chances of having a cancer over there. Okay. Now, since we are talking about the PCOS and endometrial cancer, let's see what the data says. 91% of the women who have PCOS will not develop a endometrial cancer. That means you need to be happy that because you got PCOS, not necessarily you are going to get the cancer. But yes, 9% of the women who have PCOS are at the risk of having an endometrial cancer. Now, this 9% is a data with the PCOS women. But if we talk about the women who don't have PCOS, then 3% of them can get the cancer. So when you have PCOS, your risk increases by 6%. Okay, so that is what you need to be careful about. So does that mean every woman who have PCOS will end up with endometrial cancer? Answer is no. 91% chances no, but 9% chances yes. Okay. Who will develop actually the endometrial cancer? Now that depends on plenty many factors. There are a lot of risk factors involved around. Okay, what are they and how do they affect? First, if you are a woman who don't have a menstrual cycle at all, means amenorrhea, your risk of cancer is very high compared to those women who have a irregular menses. Means more the irregularity in your periods, in your cycles, more the risk. Not only that, if for any reason you are struggling with the fertility, if you are infertile, then also your risk of the cancer increases. Of course, it depends on other factors also. Factors like, have you ever given a birth? If not, such women are called as a nulliparous. So nulliparous women have a higher risk of the cancer. What is your age? Whether are you have struggling with the obesity, whether you are having any family history of a cancer, whether you have been exposed to radiation, or you got a high blood pressure, or in your family anyone is having a cancer, all these risk parameters also depends, and if yes, then your risk rises. Now let's understand why PCOS women will get an endometrial cancer. What is the science behind it? Okay. See, we all know that when a woman have a PCOS, it creates a metabolic imbalances. Sugar gets imbalanced, and most importantly, insulin hormone gets imbalanced. In fact, one of the major root cause of PCOS is insulin resistance. So when you have insulin resistance, what happens? The insulin hormone which is present inside your body is not working very effectively. And due to that, the insulin hormones keeps rising within your blood. This we call it as hyperinsulinemia. More the insulin hormone, more the problem. High level of these insulin hormone further triggers the ovary as well as the adrenal gland, which is located on top of your kidney. And both of these glands start secreting a male hormone called as androgen. So what happened? More insulin, more androgen. Okay. Now, both of this hormone in turn again disturbs the other feminine hormone, estrogen and progesterone. So when you have a PCOS, your estrogen levels are very high compared to progesterone. And this relative abnormality causes a condition called as a estrogen dominance. So you know what happened? High insulin, high androgen, high estrogen and low progesterone. 4 major imbalances which has happened. And this causes the major trouble. Why? Because when such 4 hormones are disturbed in our body, there is a growth factor called as a IGF-1, insulin-like growth factor 1. The level of the IGF-1 also starts rising. And what is the use of this IGF-1? This IGF-1 is going to increase the multiplication of the cells. Cell mitotic activity increases, and that causes multiplication of the endometrial cells. And this is called as endometrial hyperplasia. And more the endometrial hyperplasia, more are your risk of having a endometrial cancer. So how to avoid it? Very simple. You need to have a monthly regular cycles. In olden times, during our grandmothers, they used to say, if you have a regular periods, means you are very healthy. Your body is detoxifying. Is that so? Not in actual terms, but indirectly, yes, it is quite true. Because if you are having a regular periods, means your cycles are regular, your anatomy is regular, there is no problem, means you are healthy. Not only that, removing this excess of the collected endometrium is actually not a detoxification process, but yes, your body is getting rid of the cancer causing elements. So yes, indirectly the statement is quite true. Okay, so that's about the endometrial cancer. Very important cancer in women with the PCOS, because that data shows this cancer starts rising if you have PCOS. Okay. Now move on to other gynecological cancer, that's the ovarian cancer and a breast cancer. As per the data, both of these cancer risk is not significantly raised when you have PCOS. Okay, when you have a PCOS, your ovarian androgen hormone rises, and relatively deficiency of the progesterone can cause a ovarian cancer. However, the risk is very similar to the non-PCOS women. Okay. Third cancer is the breast cancer, which is very common in a country like India. However, the breast cancer has many other reasons also to happen. It is actually a heterogeneous causes. What is your ethnicity? What country do you belong to? What is your racial population? What is your age? At what age you started your periods first? If you less than 12 years, your risk is high. If you stopped having your periods after 55 years of age, means menopause after 55 years, your risk rises. Have you ever given a birth to a child or not? If not, your risk is more. After giving the birth, have you breastfed your child? If not, your risk further rises. Not only that, have you struggled with the infertility? Have you taken any kind of a hormonal pills? Any kind of a socio-economic factors like smoking, like drinking, or illicit drug usage, or any kind of a family history? All of this can also contribute to your PCOS and breast cancer. Not only that, any other risk parameters like having a family history of a radiation exposure, okay, then any kind of other cancer associated. If yes, your risk further rises. However, PCOS per se is going to increase your breast cancer risk is not very significant as per the data. So it's not very alarmingly high in PCOS women, but most of the researches and data have shown that when you have PCOS, your endometrial uterine cancer risk rises. Okay. So now, what to do about it? That's the second part of this video. Till the first part, we created awareness. And I try my level best not to create a fear, to give you actual what is there in the medical science. But after being aware about it, what to do, that's the most important and a useful part of the video. So first thing first, know that whether do you have a PCOS or not. You must be thinking, after this, do I hear this as a solution? Yes, because many times PCOS gets undetected, undiagnosed, and directly women ends up with the cancer, and that's when we come to know that person having PCOS. So first and foremost, get a diagnosis correct. Now when we are talking about the diagnosis, you can find out about it by 3 ways. First, observe your body's symptoms. Okay. Second, get your hormonal blood parameters done. And the third one is get your ultrasound of the abdomen done. When you do ultrasound abdomen and the pelvis, you will understand whether your ovary is having a normal looking or it is a PCOS looking morphology. So that's how you will know whether you have PCOS or not. Let's assume that you have PCOS. Then what? Then second important point is know which type of PCOS you have. Yes, another very important thing. People think PCOS means PCOS. No, PCOS are very different categories. So first and foremost, know what type of PCOS you have. And if you know your type of the PCOS, you can target your treatment accordingly. And that's what the third point is, the right accurate treatment. If you are going to take a treatment for a different variety of PCOS, which actually you don't have, then you won't get that result, isn't it? So first of all, know that you have PCOS. Secondly, know what type of PCOS you have and then treat it accordingly. Then your success rate of managing PCOS is very, very high. Okay. Other important aspects is focusing on your lifestyle. It's easy to say than done, but a lot of things are missing when we talk about the PCOS. Your eating habits, high carbohydrate rich food, fried food, junk food, processed food, sweeteners, additives creates the havoc. Second is the physical activity. Make sure you are physically active. Sedentary lifestyle is going to give you a long trouble. Check on your body weight. More the body weight, more the insulin resistance. So work on your body weight. Try to reduce your body weight. Focus on your stress. Another very important thing, because most of the time, everyone, starting from a rural area to the metropolitan cities, everyone is under stress. If you are going to be under stress, you are going to be having a trouble. So focus on your stress. Another thing is focus on your sleep. Very, very important step in reversing PCOS, but very, very less taken into consideration, and that's the importance of sleep. So focus on all these your lifestyle parameters, which are very, very essential. Of course, after focusing all of this, if there is a need of the medication, you might need to take that. And what kind of medication will be best suited for you will be dependent on your type of PCOS. And for that, you can visit to your nearby doctor. By the way, just for your information, I have also made one video where we are talking about all these types of the PCOS. So if you don't know about it, do watch that video. It will give you a lot of information about it so that you can manage your PCOS along with your doctor in a much, much better way. Okay. So these are the certain points or steps you can take in order to protect yourself from developing any kind of a cancer. Early screening is very important and that should not be overlooked. So if you focus on all of these, I'm sure you can protect yourself from developing any kind of a cancer. All right. I hope my today's video helped you a bit, gave you a little bit of your knowledge about your health. If yes, please click on the like button. If you are new to my channel, then don't forget to subscribe so that you get more and more health related information, especially hormones related. And if you have any of your personal question whose answer you are seeking for, write that in the comment box below. I try to read and answer them as early as I can. We will meet again. Till then, you take care of yourself. Namaste.